thinking about this panel, I thought we could start by thinking perhaps outside of the healthcare sector, because if we think about the discussion we've had over the past couple days, there's two things that I think the pandemic really laid bare. And a lot of those things have their roots in two key isms. And I'm going to use that term very deliberately: ageism, which we've talked about a fair bit throughout the course of these past 2 days, and also ableism. So I know that ageism is something that we see in general in society. I mean, you only have to look at the depictions of aging in the media to see that. We also see it in our healthcare setting. And I'll give you an example from a Vancouver area hospital, actually. This is a research project done in 2020 that looked at older adults who were admitted to a Vancouver area hospital with the label of failure to thrive. And what they found is that 88% of those older adults who were admitted with that label actually had an acute medical illness that was the reason for those symptoms. But that's just an example of how ageism shows up. I also am using the term ableism because the currents of ableism that are inherent in our society were also exposed by the pandemic. And I think you only have to recall the really thorny and fraught discussions we had around triage protocols at the height of the pandemic to understand its presence in the healthcare sector, but we also saw it in the general community. And I'll point to one probably really well-known example around the perception that the public health orders that were designed to protect the medically vulnerable were an unfair burden to the so-called healthy population. So ageism and ableism are two of those things when we think about the roots of what we saw in the pandemic. I think those are two key factors that played into it. And I realize that this is an uncomfortable thing to talk about, especially when I bring up examples of ageism or ableism in the healthcare sector. It doesn't feel very good. But stick with me on this one, because this part's important, because for people who are living with dementia or some form of cognitive impairment, they get the double whammy. They get ageism and they get ableism. And I want to recognize that not everybody who's living with dementia is an older adult. We certainly do have early onset, but the majority of people who are living with dementia are older adults. So they get the ageism lens, but then they also get the ableism lens as well, because we know that the moment somebody discloses that they have dementia or some form of cognitive impairment to their friends, maybe their healthcare provider or other people in their lives, they're often treated differently and somehow less capable than what they were 5 seconds before they made that disclosure. So we see those come to bear. So that's the bad news. But the good news is that there's an antidote to this, and it's powerfully simple. And we've heard great examples of it already today, and that's inclusion. And inclusion is really about enabling people to participate as full members in the communities in which they live, wherever they call it home, whether it's a long-term care home or whether it's the house down the street in your neighborhood. And the reason why inclusion matters so much is because there are over 70,000 British Columbians who have a diagnosis of dementia. It matters because 2 out of 3 of those British Columbians living with a diagnosis of dementia don't live in long-term care, they live in the community. And it also matters because despite that number, we know that there's about 65% of Canadians living with dementia who are yet undiagnosed. And finally, it matters because by 2030, and you've probably heard this figure before, there will be nearly 1 million Canadians living with dementia. So what does it mean for us? Well, when I was thinking about it in the context of this panel, which is the spirit of dreaming big, it means that we can't treat dementia as solely a healthcare issue. Yes, having access to adequate, well-designed, person-centered care is incredibly important, but it's not the only thing people need to thrive. And we heard that again this morning. You know, people need social connection, they need purpose, they need access to space outside their home. This means things like inclusive building design, accessible transportation, and a broader cultural shift in how we include and we invite versus exclude and marginalize people living with dementia in our neighborhoods. So if we're going to dream big, then we need to talk about dementia inclusive communities. And there's a lot to talk about here. For example, at the Alzheimer's Society BC, we work with municipalities, business, transit, law enforcement agencies to support a dementia inclusive approach. And that includes everything from training and education for workers to bringing a dementia lens to emergency and disaster response plans. You know, Deborah Sheets spoke this morning about initiatives like Voices in Motion Choir. We also see things like the Imagination Network, which use art mediums to share and include and bring people together who are living with dementia with other members of the community. Nationally, we see things like the Dementia Friendly Canada initiative, which is a collaborative effort involving Alzheimer's societies across Canada. And this includes education and resource toolkits and other materials that are targeted at the retail, the hospitality, community services, and transit sectors. And similarly, at a national level, we see things like the National Ballet School's Dance or Not Dementia campaign. Internationally, we see initiatives like the UK's Dementia Friends initiative, which has since been adopted, by the way, in 56 countries around the world. These initiatives have impact. A study that was looking at the Dementia Friends initiative found a statistically significant improvement in the attitudes of participants toward dementia, increased dementia knowledge, and increased comfort around people with dementia, social comfort around people with dementia. All of these initiatives that I've just mentioned serve to enhance inclusion. And if I haven't sold you on why that's important, I got some data for you as well from a Canadian context. And this was a survey done in 2017. 50% of Canadians don't believe they could live well with dementia. And in fact, 27% believe their life would be over after getting a diagnosis. 1 in 5 Canadians would avoid seeking help for as long as possible if they thought they had dementia. And 58% of Canadians believe that people living with dementia are likely to be ignored or dismissed. This is the stigma I was talking about. This is those isms manifested. And as members of the broader community, yeah, you are healthcare workers, but you're also members of the broader community. And you're immersed in this, whether you know it or not. The good news, like I said, is that it doesn't have to be this way. And the best tool that we have is inclusion. So I'll leave you with this sort of thought starter question as we get into it. But I'd like you to think as a member of society, so not necessarily somebody who works in the healthcare sector, but more broadly than that, as a member of society, what are you going to do to ensure that people who are living with dementia are welcomed and included in your community, in your neighborhood?
Yeah, thank you very much, Jen, and it's lovely to be here again on day 2 and for part of the closing panel. And when we start thinking about thinking big, I just want to build on a lot of what Jen was just saying about how do we have to think about this not just as kind of a healthcare issue, but kind of as a societal issue. Because when we start thinking about what do we mean by aging well and what will help us get there, we can't just think about improving the healthcare system. We can't just think about social care, for example. We have to think about financial security, and we have to think about those isms. And I'm going to throw on an extra ism that was really clear as part of the pandemic and part of our pandemic weaknesses. It's not just about ageism and ableism, but also racism, just to just to throw it out there, especially when we realize that a lot of the care systems, the fragile care systems we built right across the country, are often on the backs of racialized women who often are paid, unfair wages, for example, to do some of the most important work that we see. And it was only through this pandemic, really, that we started to see this whole angle of how we've actually disenfranchised an entire workforce who's already working with a disenfranchised population that makes it really, really tough. Because when I think about Toronto and I think about Vancouver, I think about these centers that we have that are incredibly multicultural. We have to realize that a lot of the care and support that's already hard to access for the average Canadian becomes incredibly more challenging when you're older, when you might have dementia. And if you don't especially have a family or yourself being able to communicate easily in English, let alone French, you start realizing how much our system really disenfranchises the most vulnerable, not only individuals, but also workers amongst us as well. And so this is challenging because I think this is what the pandemic has really kind of laid bare for a lot of us, is that if we want to get to a future, if we want to think big, we need to really rethink the way we approach a lot of these ways that we've traditionally run care. I have to say that throughout the pandemic, I've been doing a lot of work through our National Institute on Aging, looking at what's been happening across Canada. And it was actually in 2019, in late 2019, our NIA released a series of reports. The first one was called Enabling the Future of Long-Term Care in Canada. The second report was looking at the future costs of long-term care. And really, what we really helped to outline is what that journey is going to look like for us over the next 3 decades, for example, if we do nothing differently, and where we can look to inspiring models across the country, but also around the world to actually show how we actually have a challenge, but we have an enormous opportunity to do better. And this is where we started thinking about this whole concept of age-friendly communities. And really, how do we create communities that can allow older people to thrive and to be more included, and to remain productive and engaged citizens as they want. And then thinking about as we age, and knowing that within a decade, 1 in 4 Canadians is going to be 65 and older, and our baby boomers are going to start turning 85, this is where we see rising rates of dementia and a growing demand for long-term care that we are going to have to meet. Right now, we know that across Canada, 430,000 Canadians report that they have unmet home care needs. And this is partly what's driven a wait list of over 52,000 Canadians who, if you can't get your home care needs met, for example, you're going to end up on a wait list for a long-term care home. So we have a system that's constantly prematurely institutionalizing people and is not ready to even meet the demands of its current population, let alone one that's aging in future. So we start to lay out a framework thinking about this notion of age-friendly, dementia-friendly communities, but then thinking about a system that starts to prioritize care that is closer to home, care that allows people to age as well as possible for as long as possible, so that they can hopefully avoid having to require forms of long-term care, such as home and community care, or even long-term care. But it's not about saying that we should not support these care systems. We have to absolutely support these systems, because we can see what happens when we have long-term care homes that are not well funded, not well organized, not well designed. They become places where people are not going to thrive, and where people are unfortunately going to suffer even more. And, just let alone, visitor policies and other things, we see how many things that we've often overlooked, or ways in which we don't actually engage, the rights of older people. So I think some of you may have seen a recent trip that I made to Denmark, and you might have seen my exploits with Erica Johnson, one of the lead reporters who's based in Vancouver, as CBC Marketplace started investigating, our issues of long-term care across Canada, but specifically, what are the solutions? What are the opportunities? And it was amazing, because I think I had already read a lot about Denmark. I'd written about Denmark, and that's why CBC said, Dr. Sinha, you seem to be really excited about them. What gives? And as I explained to them, they said, you're making this up. Does this really happen? That's why we went overseas, and we actually went to see it in person. And it was only, after spending a few days a bit further, you started realizing within minutes how everything was different, because we often use the term patients, we use the term clients, in terms of how we refer to people. We even kind of qualify them as maybe older patients or older clients. But what was fascinating was, when we were interviewing the head of a regional municipality's home care or long-term care program, she just kept using the term citizens. Every time we might use the word patients or clients, she kept on saying citizens, not even older citizens, just citizens. And I just said, stop the camera, hold on 1 second. I said, Erica, stop saying patient, because we don't call home care people patients. If you need a bath or you need someone to help take you for a walk, for example, that doesn't make you medicalized. You're not failing to thrive, as Jen mentioned. You just need some help. But I said, well, but over to you, Camilla, the head of the Home Care Authority and the Long-Term Care Authority. I said, why do you keep using the word citizen? Is that a you thing, or is that a peculiar? She said, no, we all call them citizens. Why would you call them patients? Why are they clients? They're not consumers, right? They're not patients. If they need someone, they have homes. We come into their homes. We just do what they'd like us to do. And it just amazed me about that mindset, just building on what Jen was saying about changing our entire mindset, and then actually funding a system appropriately that meets people where they are. A system where they used to actually come by your house at 75 as a free public service to kind of just say, hey, how are you doing? What help do you need if you need any help? Do you know how to connect with the Alzheimer's Society? Do you know how to connect with BC Home Care? Or do you know about the new dementia village that Candace is building? And might that be an option for you? And just by proactively having those conversations, they help people stay independent and healthy longer, meaning that they can actually save on people having to decline and need more home care and eventually long-term care. And by better supporting more home and community care, they actually have a far less demand and need for long-term care in the end. But when you see their long-term care, it's incredibly well-resourced, it's incredibly well-organized, and it's saving their healthcare system billions of dollars every year. So there is a future ahead of us. I think there's an opportunity for how we can look at aging well. I'll keep beating the drum and showing that it is possible, it is happening. And what's been nice to see during the pandemic is how BC has taken, especially over the last few years, a number of initiatives that have actually made it more of a leader in Canada than other parts in terms of better investing in its long-term care, home and community care systems, organizing them as publicly funded, organizations and organized entities. And I think there's a bright future here, and there's a good foundation to build on, but there's a lot more to do, and there's a good example that we can look at, not only across the ocean, but also across Canada as well. So with that, I'm going to pass it over to my friend Candace, who abandoned me from Ontario to get out to BC. But I'm gonna let her tell us a little bit more about what's inspiring her and how she's thinking big.
I wanted to kind of talk about what it is that we are doing, and the construction has actually begun with Providence Living, and we are building Providence Living Place Together by the Sea. And it, I believe, is the first publicly funded long-term care home based on the concept of Dementia Village. So it's a $53 million project, but it's been developed in partnership with Island Health, one of BC's 5 health authorities, and in consultation with the Comox First Nation. And why I wanted to show the visuals is because it's everything we've heard over the last couple of days of just how incredible the future for seniors living in this this new home is going to be. So basically, the site preparation just started in December. Construction's well underway. The new innovative village will replace our current long-term care home of 156 beds. But it's the design that really excites me and what drew me to BC, because the design supports the philosophy of care that promotes freedom of movement, safe access to outdoors with, if you look at the screen, you'll see, if just picture this, and I actually was there this week, and I could not believe the size. That interior courtyard that you're looking at in the center of the building is an acre. That's an acre of green space for our citizens to live in, and it's incredible. It's going to have that secure interior courtyard, and there is going to be like covered areas where the residents can have time with their families. They're going to have access. It doesn't matter from where they are. We also have an Indigenous ceremonial place in collaboration with the Comox First Nation. We've been working with them very closely. We're going to have a chapel, there's gardens, there's a bistro, children's daycare, community space, a village store. So it's just, it's unbelievable what the residents living there, the citizens living there will be able to experience. So as a Catholic-based organization, the site will include the chapel, but it will welcome all denominations. So if you're looking on the screen now, you'll see that all the exterior colors are very warm, earthy colors. And then inside, if you look at the high roof area, that's actually going to be our big house. And so what we've been doing is working closely with the Comox elders and leaders to plan the big house using traditional materials and following traditional interior layout. So if you go to the next slide, you'll see a better picture. You'll see the open lawn, the central shelter for events, the children's area, the chapel. And then if you go to the next slide, that's actually the big house. And we really expect that Providence Living Place and Together by the Sea will eventually be home to some of Comox elders. And we're hoping that this space, as well as our commitment to cultural safety and humility, will make our entire facility welcoming to all. So it's pretty incredible. But I think the bigger piece, beyond the bricks and mortar and the absolute intense work that's gone into creating this design and this space where you'll have small villages of 12 citizens living together with their own rooms, their own bathrooms. You're not going to have nursing stations. It's incredible. It's going to be so similar to their own home. Like we're meeting every week, like going right down to what the cabinetry is going to look like. So it's not going to look like your traditional long-term care home. It's going to actually very similar mirror the residents' homes based on what their background is. The bigger piece, though, is what we're doing around the model of care. And we're shifting from that clinical medical model of care to the social model of care. And we have looked at this and we've used we've been inspired by the European models, by the De Hoogwyk Dementia Village in the Netherlands, and the inclusive community that they have up and thriving today. And it's taken them a long time. And so we know this isn't something that's going to happen overnight, but we also know that it's something that we're completely committed to. And what that means is that whole person-centered approach and that social model is something that we're hitting the ground running now. So one of the exciting things that we're working on now, we're calling it Home for Us. And it's our Home for Us model of care. And we're creating it jointly with Providence Healthcare. And we're using pieces of the De Hoogwyk example. And we're going by 3 guiding principles for Home for Us. And they are: emotional connections matter most, residents direct each moment, and home is not a place, it's a feeling. And we are actually renovating an area, and we're going to set up a mock village over the next 2 years. And we're working on care flows. We're working on everything that we need to do, policies, procedures, so all of the legislative pieces. But what we're doing is we're going to have residents living in this village concept. And we're going to change the way we do things. And we're going to have staff volunteer to come in and work through that change from that medical model to the social model. And that's really exciting, because I think that will give our staff and our families and our residents the ability to live this model over the next couple of years. And then we open our doors. So we're not just doing things on paper. We're actually recreating the whole village concept, and we're going to hit the ground running. We've got new teams being set up. We just had a town hall last week, which was incredible. We have staff volunteering to be a part of this experience. And that's the stuff that excites me, because it's not just bricks and mortar. It's a whole different way of doing things. It's a whole different way of caring. And it's a whole different experience for the citizens that we're going to be caring for. So I just wanted to put the visuals out here just so you could see the difference of what it's going to look like compared to your traditional long-term care home. And if you think of what we've gone through for the last 2 years and the devastating impact on seniors living in long-term care homes, where, because of their infrastructure, a lot of them lost their life, and that should never happen. And so everything we're doing, we're looking at, how can we minimize that risk to the utmost degree, but how can we create an environment where people can age in place and be as close to their home as possible. So with that, I will pass the baton.
Great. Well, thank you very much. It's actually quite daunting to be the last speaker on a panel like this, where everybody clearly has a lot more experience and lived experience and expertise in this area. So I feel somewhat daunted, but I will offer a few thoughts. I tried at the beginning of the talk that I gave this morning to seed the idea of dreaming big by ending with what I think is in fact the most important question. What kind of world do we want to live in? And I was really purposeful in choosing the word world because that's the context within which people are living. We all live within families and communities, and they're kind of interesting concentric circles. And yet at some point, what we need to understand is that we are in fact not just citizens of a country, we're citizens of the world. And so in that context of sort of dreaming big, I was inviting us to think about values-based living and values-based working. And so while I knew that many people would be better placed than I am to share important information about changes that need to be made to the built environment, to the infrastructure, to the personnel resources available, to the working conditions, all of which I think are really important in terms of creating the right kind of environment, that's not my experience or expertise. And so what I really wanted to do was to focus on the person and to ask questions about how is it that we ensure that our elders, whether they're in long-term care facilities or living in their homes, feel supported, included, welcomed. And for me, all of that comes down to respect. And in that context, I tried to give a couple of examples about, how is it that we show respect? What are the assumptions we have about what constitutes respectful engagement? And how is it that some of those assumptions can in fact be challenged in this particular phase of life? And so I wanted to focus on both the personal and the personnel. And I wanted to emphasize the importance of belonging and recognition. That we spend our whole lives in webs of relationships, whether they're through work, through church, through community, and that what happens through aging is that some of those relationships break. And as they break, it actually has a real impact on your sense of self and your sense of having a place in the world. And that responsibility is a shared responsibility because a person can't just say, I'm here, I matter. Other people have to acknowledge that and say that back and instantiate that. Yes, we recognize you. You're here. You matter. One of the things that I think is really important, and I was really pleased to hear Candace talk about, the daycare, but in a way, one of the things that I think is so fragile is the way in which in a modern world, we actually don't have generations living together in the ways that we did before. And we're not going to in the near future. That time has come and gone. But what has happened as a result of that is that people do live segregated by age groups. And I tried to sort of contest that with two images and stories, one of them showing my great-grandmother with my daughter. And for those of you who heard that presentation and saw that image, my daughter was interested. I mean, that's the part that I thought was interesting, like they're engaged. And then I also spoke about my father, who actually opened his home to university students so that he could be surrounded by youth. And it's not just youth, it's different ideas, different places in the world that you then get to be part of it because you have a conversation about anything, whether it's sport or politics, and you get a different perspective. So one of the things I think we still need to work on is how is it that we keep people integrated in the world? And that includes a range of activities and a range of ages. The last kind of point I want to make here is that it is important, and I do recognize that for both what I would think of as professional caregivers, paid caregivers, and family member caregivers, we really need to understand that they too are deserving of being valued and respected. And so I think it's an interesting balance that we somehow have maybe failed to bring to the fore. I think about that in terms of making sure that people have adequate resources to do what they can do well, so that people have pride in their work because they understand what's expected of them and they've been given adequate training and skill development. In the context of those who are doing this for paid labor, they do need adequate pay. And maybe we really need to think seriously about a tax credit for family members. The comment was already made about the ways in which some of this work is very gendered and also racialized. And so we really need to think about that in terms of what would it mean for that work to be respected and for the people to be treated respectfully. I want to end my comments anyhow by talking about something that was alluded to by Patty earlier, which is this notion of moral distress. And some really important work has been done in nursing ethics around this concept and how it is that people who find themselves knowing what the right thing is to do, but that for a series of circumstances are unable to do that, and they live with moral distress. And I am confident, as another speaker made a point about PTSD amongst care providers coming out of this pandemic, many people have experienced moral distress and are living with that. But there's work that I did with a colleague, George Webster, on the concept of moral residue. And moral residue is when moral distress lingers. It's what each of us carries with us from those times in our lives where, in the face of moral distress, we actually compromised ourselves or allowed ourselves to be compromised. And so what I'm hoping for when I dream big is that everybody's focused on that big picture question, what kind of world we want to live in? And then how will this behavior, how will this building, how will these working conditions, how will, and fill in the blank, help to build this world, the kind of world that we all want to live in?
I just wanted to build on just a few comments. One is, coming back to what Françoise was saying about in terms of, what kind of world do we want to live in? I think the fact of the matter is that it's a great, premise to start having our conversations to refocus that. And as we said, it's not about being a health-centered focus or a patient-centered focus or that. It's just about thinking of ourselves as citizens of a world, and frankly, that we ultimately have a lot of power. And a lot of what we're talking today, what we've been talking about in this panel, and I think talking about over the last few days, is really applied common sense. And the nice part is that you hear about kind of the ways in which, that isn't this going to be costly? Is it going to be way too costly to do this? And often, I can say to my friend Candace, who's being very politically correct and saying grateful for the funding she's got, but it's not enough. Right? Ultimately, in order to build what she wants to build, for example, she's got to put her hat out and ask for foundations and other people to give her money to adequately build what she wants to do. And ultimately, we know that actually when you invest in good quality, living spaces and communities, you actually end up saving money because people end up actually, leading healthier and active lives, and they don't end up in the hospital where it costs, way, way, way more money to provide care for a person in a crisis. Often when we're describing them as people who've been diagnosed with failure to cope or failure to thrive, when we're not recognizing the failure that we have had as a society, when we've deliberately built a system that's not providing care in a cost-effective and dignified way to provide that support. So I want to leave with the message that it's possible. And I wanted to challenge one thing that Françoise said as well. It's a good challenge, right? Because I think, it's that notion that, it's inspiring us with that comment about what world do we want to live in? And then is it even possible to think about intergenerational living? Is it even possible to think about building that community where people come in? And it absolutely is possible. This is what I want to challenge and say that I don't want Françoise as a colleague and friend to give up on this notion, because, one of the most incredible things I got to see on my last day in Denmark, and I was so grateful that we got to see it, was something that the community, that the actual, what they call commune, or the city actually built. So they're in the business of building housing, and they built a brand new development by the sea, and it has a lot of, it looks like downtown Vancouver, lots of towers, if you will, but right in the center of the community was this tall tower. It has 436 units in them, and this is for 436 citizens of all ages. It's called the House of the Generations, and you can look it up on online. But it was incredibly inspiring. The city owns it. It's basically it's government housing, if you want to call it that, and whatever that means. 436 units, all built with modern design. So there's no levels in this whatsoever. In terms, it's a tower of 14 stories, but there are no levels. In fact, I kept on interviewing. I remember interviewing a 92-year-old former Canadian from Calgary who happens to be living there because she married a Dane And she has, she reminded me she has 20 great grandchildren right now. But I said, what do you love about this place? And she said, oh, it's great to live here because it has no levels. And she was saying this to me as she was standing next to this big grand staircase that goes right down the center. And I thought, what do you mean? But I kept all through the day as I spent time, I kept seeing her everywhere, in the gym. I kept seeing her down in the cafe. I kept on seeing her just with the, there's a nursery on site, and during the day, when it's their time for do sing along, the elders actually join them. And I remember I said, wow, it's beautiful. They're all just playing together and singing together. And I actually asked someone, I said, well, what are they singing? I mean, it's in Danish. And they said, oh, they do nursery rhymes together every day. And I said, why nursery rhymes? And they said, duh. It's the most practical thing for everyone to sing. The kids need to learn the nursery rhymes, so the elders and the other people are gathering together to make sure they can teach, because these citizens are teaching the younger generation. They're not there to be cared for. They're there to teach. That's why they're there. They're there to teach the young kids. And for those citizens who might have dementia, these are the songs that they will absolutely remember, because it's some of the earliest songs they did. But nobody was talking about it from a clinical standpoint. It was about living. And living with dignity and supporting each other. And what was cool was in this place where everything moves up and down in terms of your kitchen needs. There's lifts that are available in your bedroom should you need it. The bathrooms have no bathtubs, there are no levels, there's no nothing. And everything's built wide enough so that your caregivers have space to safely care for you. 2, if you need them, 1, or just you can do whatever you can on your own. So it was incredibly enabling, because then when I run into various older citizens, I'd ask them, are you living in the retirement home side, or are you living in the nursing home side? But because all the apartments are intermingled, a lot of them couldn't even tell me where they were living. They just said, well, I think I live in the in-between thing. And I'm like, they couldn't even tell me if they were in a nursing home unit or in a regular apartment for older unit. They definitely, and then there were homes for those who might have disabilities, physical disabilities. And it was great to just see people hanging out in the gym, where again, they were, where people were saying, this is Johanna, she's 50 years older than me and she's my best friend here. And we work out together every day. There was nothing artificial about it. But what was really cool was this is a place where people weren't forced to live. Everyone there chose to live there. And everyone was so hungry to live there. And what I commonly heard from everyone was this whole building opened in 2020. It's now full. And everyone was expressing a sense of loss, because they've lost time over the last year or 2 during the pandemic, but they are so hungry to build the community that they've chosen to live in, a community where it allows them to interact with people of all ages, to build a sense of community. And I think there's more of us out there who are hungry for things like this. But what was cool in all of this was it's all doable. This is not a ridiculous cost. Everyone there's paying rent. Everyone's actually doing this, and it can work. And what I kept hearing throughout this entire approach, kind of that the Danes have taken, and that frankly we're starting to inch towards in various parts of Canada, is that when you actually do a proactive investment in helping people, reach their full capacity and live independently, you actually save dollars and cents down the road. And you have not only happy citizens, but you also have happy workers who are being seen and recognized and supported as well. So I just wanted to leave this with the note, really, that I actually think that everything we're talking about, if any of you are watching this and saying, yeah, a bunch of talking heads and they're dreaming. No, actually, we're not dreaming. We're actually talking about things that are truly possible. And finally, about, how do you actually get and achieve this? You've developed what I like to call a coalition of the willing. Too often, we're parts of organizations that like to keep things proprietary. They don't want to share information. And I always say the best thing you can invest in is R&D. People say, oh, is that research and development? I said, no, it's rob and duplicate. It's because we actually have all the right ideas out there. The key is that we're not doing enough to share them. And I know through our National Institute on Aging at Ryerson, everything we do, even when we get commissions from the Government of Canada, when we get commissions from the Alzheimer's Society, from the Red Cross, from any of the organizations we work with, we actually always say to them, right, part of the condition is whatever we write for you, we actually get to share publicly, because we actually want everybody to know what we have learned and what we've generated and how we can make that publicly available for free, so that our ideas are not exclusive. They're there for people to rob and duplicate. So, so we're happy to partner. We're always happy to be a part of anything. And I just wanted to say thank you again for inviting me as a Torontonian, a former Winnipegger, to be part of the West Coast Conference, because it's always nice to be with my friends. I'm sad that we couldn't be there in person, but I look forward to dialoguing with you virtually or soon when I get to Vancouver later this month. Take care.